or somebody that you know have social anxiety disorder? If so, do you even notice it? What are they like? According to the ADAA 2016, an article, Understanding the Facts, Social Anxiety, about 15 million American adults are diagnosed with social anxiety disorder. The age of onset is about 13 years old. Social anxiety is a common disorder that needs treatment. Many people need to know what social anxiety is, the treatment for it, and how to overcome this. To start off, many people do not know what social anxiety is. Thomas A. Richards, in an article, What is Social Anxiety, 2017, says that social anxiety is the fear of interaction with other people that brings on self-consciousness, feelings of being negatively judged and evaluated, and as a result leads to avoidance. According to Social Anxiety Institute 2017, this states that people with social anxiety disorder have the symptoms of sweating, dry mouth, turning red, and a faster heart rate. According to the Mayo Clinic staff 2017, many people with social anxiety are fearful of others noticing all of these physical symptoms. They're also always worried about what others think of them. They overanalyze past conversations and overthink them. According to the Mayo Clinic, people with this disorder fear talking to strangers, and they're worried about offending others with what they say. According to Richards, 2017, he states people with social anxiety disorder know that their anxiety is irrational and doesn't make sense. Nevertheless, knowing something is not the same thing as believing or feeling something. Many people with this disorder want to go out and talk to others with confidence, but that is not the way that this works unless they get treatment or they overcome this. Also, according to the Mayo Clinic, 2017, people with this disorder avoid dating, talking to strangers, entering a public place where people already are, lots of use of eye contact, and use of public restrooms. These symptoms may seem like no big deal to many, but people with this disorder, it's an everyday struggle. Now that social anxiety has been explained, people now need to know how to treat this disorder. Once diagnosed, the next step is finding the best treatment for your disorder. According to an article, Social Anxiety Disorder Treatment Overview by WebMD 2017, they state that treatment for social anxiety disorder involves psychological counseling and sometimes medication to reduce related anxiety or depression. WebMD 2017 also states that many have worked on their fears with a counselor. There's also ways to reduce stress by certain breathing activities. In the article, Social Anxiety Disorder, More Than Just Shyness, written by NIH 2017, there are 3 types of medication that is used to help treat social anxiety disorder, including anti-anxiety meds, antidepressants, and beta blockers. The most powerful and most popular one is the anti-anxiety medication. This anti-anxiety medication takes a while to kick in, but once it does, it reduces the symptoms and the stress. According to NIH 2017, unfortunately, many people don't seek treatment when they have this disorder. This may be because of many reasons. One of those reasons is maybe that they do not think that the symptoms are that bad, or maybe they do not even know that they have this disorder. There are many different ways to treat this, but there's also a way to overcome this. Many people overcome social anxiety disorder. According to Richards, he says that getting over social anxiety disorder is not an easy task, nor is it a difficult one. Many of thousands have done this. Richards also states that making sure you understand what your social anxiety disorder is very important, and that's how you will overcome it. Another way is to practice the cognitive attempts and concepts so they become automatic and a lot easier. Finally, you can join a group with other people who have this disorder. Claimed by Richards, therapy groups for social anxiety should always be encouraging, positive, and supportive. These groups need to be welcoming and need to be a comfortable place for people to talk about this disorder. These groups should help but not hurt. If people are motivated enough to overcome this, then they will succeed. Since social anxiety is so common, people will definitely need to understand the details. People should have a full understanding, know the treatments, and know how to overcome this. Personally, having this disorder has been a struggle, but good news is that there is treatment for this disorder, and there's also therapy for social anxiety disorder. This makes this disorder a lot easier to live with and easier to understand. All right, so question and answers. Okay, you want to go?
Yeah. Does it affect men and women the same, or one more than the other?
It does not affect them the same, since it actually will affect the women earlier than men, and more. It actually occurs more in women than men too.
Is there a permanent cure? I mean, or does this just stay with you your whole lifetime?
There's no cure, but like I said, you can overcome it, but it'll always be there, and you'll always have to go through it or use treatment too.
Is anxiety hereditary?
Yes, it's more likely to be passed down in families.
When did you first notice that you had social anxiety?
Back my junior year in high school, so I decided to go into the doctor and get treated for it. You know what I mean?
Can it be controlled by prescription drugs?
Yes, it can, but again, it's not. It'll still always be there, and it makes it easier. Just not. It doesn't make it go away.
Is it with you 24 hours a day, or is it more with you during the day or during the night?
It's more during the day if you're out and about doing stuff. It's triggered, like I said, like going in use of public restrooms, having to talk in front of people, having to go into a place where people have already been, stuff like that, or where they still are. So it's more during the day.
Is it a mental illness?
It's, yes, it is.
And what kind of medication do you take?
I take the anti-anxiety medication. I don't know the name of it, but that's the one where the doctors told me it would take about 8 weeks to kick in, and they were about right, so you don't give up on it. So, yeah.